Now, in the administration of this particular chemotherapy, we have what is called as adjuvant chemotherapy and as well as neoadjuvant chemotherapy. Now, let me tell you what do you mean by adjuvant and neoadjuvant chemotherapy, and let me tell you in which particular cancers you require the neoadjuvant chemotherapy. So, if you take the word adjuvant chemotherapy, so if you take this adjuvant chemotherapy, remember this adjuvant chemotherapy is administered after surgery or radiotherapy, right? It is administered after surgery or radiotherapy. That is what is called as your adjuvant chemotherapy, right? Administered after surgery or radiotherapy. Whereas if you take the word, right, if you take the words neoadjuvant chemotherapy, so if you see this neoadjuvant chemotherapy, remember this means the administration of anti-cancer drugs before surgery or radiotherapy, right? Administration of anti-cancer drugs before surgery or radiotherapy. That is called neoadjuvant chemotherapy. So adjuvant chemotherapy after surgery, neoadjuvant chemotherapy before surgery or radiotherapy. Now let me tell you in which cancers the neoadjuvant chemotherapy is used. Remember, this neoadjuvant chemotherapy, it is used in cancers of, right, it is used in cancers of bladder, right, used in cancers of breast, used in cancers of colorectal carcinoma, right, used in cancers of the esophagus, stomach and as well as lung, right? So in these particular cancers, and that too which type of carcinoma lung? It is in case of non-small cell carcinoma of the lung. So if you take the bronchogenic carcinoma, that is carcinoma lung, like we have 4 types. One is small cell carcinoma, adenocarcinoma, squamous cell carcinoma and large cell carcinoma. So in case of non-small cell carcinoma, we use this neoadjuvant therapy. So in cancers of bladder, breast, colorectal, esophagus, stomach, lung carcinomas, we use this neoadjuvant chemotherapy.